ગુડ ઇવનિંગ ભૂપેન્દ્રભાઈ.
સર કેમ છો? ગુડ
કેમ છો તમે?
એકદમ સર.
તમે ટાઈમ આવી, આજે તો સ્પોર્ટ્સ છે એટલે ટી શર્ટ પહેરો. તમે ટી શર્ટ પહેર્યું છે. 10 ફીટ લાગવા જોઈએ ને આપણે, બરાબર? જો
સાચી વાત છે. બસ સર હું થોડું યુટ્યુબ લાઈવ માટેનું કરી દઉં પછી
ઇવનિંગ.
રેડી છે તમે?
ગુડ ઇવનિંગ મેડમ, કેમ છો?
ગુડ ઇવનિંગ. બસ ફાઇન.
કેમ છો?
કેમ છો કેતનભાઈ? ગુડ ઇવનિંગ.
મેં ભૂપેન્દ્રભાઈ ને કહ્યું આજે તો ટી શર્ટમાં રહેવું જોઈએ આપણે, ને સ્પોર્ટ્સ ને યંગ.
હા આઈ નો, મને પણ હવે એવું થયું. લો તમે બોલ્યા એટલે ચમકી.
એકદમ આમ મસ્ત
ના
રેડી.
હું આમ જ રાખીશ, ખાલી મોડું એટલે નીચેનું ડ્રેસ નહીં દેખાય.
વેલકમ જય.
કેવું છે? કેમ નીકળી ગયો ભૂપી?
મેડમ હું થોડું યુટ્યુબ લાઈવ માટેનું કરી લઉં પ્રોસેસ.
હા કરી લઈએ.
Okay. Hello everyone.
હાય.
ગુડ ઇવનિંગ ડોક્ટર જયમીનભાઈ.
Yes,
Good
Ketan.
evening.
કેતન શાહ ફ્રોમ સુરત.
Oh yes, pleasure, Dr. Jamie. Yes. Yeah.
Sir, I was just going through your CV. You have not left any single joint for repairing.
Oh yeah. None of the surgeon will leave anything.
Yes. Shoulder, hip.
સર્જન ને આમ રેસિસ્ટ કરવું પડે, આમ અર્જને કે ના કહેવાની છે આ પેશન્ટ ને.
That to an orthopedic surgeon.
That to an orthopedic surgeon, yes.
So spine બાકી રહી મારા ખ્યાલથી.
Ketan bhai is a pediatrician in
Surat.
Surat.
સુરતમાં છું. I'm a pediatrician.
Yeah. No, I was in Surat.
એ તમારાને થોડું થોડું વળે છે, ર્યુમેટિક વર્ક સરસ કરે છે એટલે તમને થોડું થોડું વળે.
તમે સુરત થી કર્યું છે?
No, I was transferred there as an associate professor in 2010. So I was there with Majuragat Civil Hospital for 2 years.
Okay. I'm also from GMC Surat. અને મેં 92 માં પાસ કર્યું MD pediatrics.
આપણે હું એકવાર પીપીટી શેર કરીને ચેક કરી લેવું છે કેતનભાઈ. આપણે હું કરું શેર સેજ.
ને ભૂપેન્દ્રભાઈ થી થશે કે
ના હું શેર કરું છું.
તમે કરો, બાકી થાય તો આપણે જોઈ લઈએ.
Somebody join with 2 instruments, echo થાય છે. વેલકમ કૃષ્ણાબેન.
Yes, thank you. And
Hi.
so,
Hello,
Krishnabin.
Yeah.
Ji, good afternoon.
I'm Ketan Shah from Surat. Snehal ma'am, Amari majority Vedike, she is also from VNSGU.
Yes.
When I was reading your biodata, you are from Surat.
Yes, basically I'm from Navsari. Of course, that's the largest one covering the Gujarat portion, like South Gujarat from Vapi to Tapi. But actually, I think Bharuch ne બધું જ cover થઈ જાય છે. So, of course, the base is from VNSGU.
Yes. Jamin sir is from Surat, you are from Surat, and I am also from Surat. So,
Wow.
good voting for Surat.
અમારા બધા બહુ મિત્રો from Surat.
Shravan is a swimming. I think you are looking after swimming. You are
Yes.
a swimming coach. Yeah.
Yes. I represented 14 times Gujarat at the national level, and since 2017, I'm with the Sports Authority of Gujarat, and at before that, I was associated with the Olympic cycle. That's I done my MS from Patiala actually.
Okay, great.
So I am basically associated with the so many games, like when Neeraj was getting ready prepared for the first Olympic cycle, and we saw to fail to qualify, so I started my journey from that. So I associated with the many games, and from the sports science background, not a coaching background, but yes, I'm with since 10 years I'm with the coaching field, and swimming, triathlon, biathlon, and I also represented 81 kilometer from Bangladesh to Kolkata. So that's open water swimming. So my when I was like મારું જે ડ્રીમ પૂરી નહીં થવું તે બચ્ચાઓ અત્યારે ફૂલફિલ કરે છે. So 10 are represented in India. In triathlon they are medalist, and swimming also.
So good, ma'am. Huh? So good. Proud of you to be in Gujarat and Baroda. Yes, please. Jimin sir, તમે કયું સ્પોર્ટ્સ રમો છો?
I was playing long back. Of course, I became a sports medicine doctor, but I did play football, badminton, almost all the games during school and college life.
Welcome, Utpal bhai. Welcome, Sushma ma'am.
Very good evening, Snehal. Can I just wish my message over here? And I'm sure we're yet to start the meeting, but I'm busy with another webinar. So I just wanted to be here as I promised. And it's a sheer pleasure to be with my own family. And when Ketan, yourself, Bhupendra Bhai, Nishil Bhai, all around, it looks like, at home. So just a few words and I live. So very good evening, dear Gujarat HF family, Snehal Ben, Bhupendra Bhai, Nishil Bhai, Ketan, and all the hobbies of Gaha, the esteemed panelists, Dr. Pemle sir, Dr. Geeta ji, Dr. Jarmin, Utpal Bhai, and Krishna ji. First of all, I express my heartfelt pranam to all the gurus who enlighten our life with the knowledge, humility, and wisdom on today's auspicious day of Guru Purnima. In today's world, when adolescents and young adults aspire to choose sports and athletics as their career, I extend my hearty congratulations to Team Gaha for the aptly chosen topic as well as the galaxy of faculties. My sincere apologies for not being able to attend today's webinar due to another engagement, but I am always there with my own family, Gaha, and I extend my best wishes and lots of love and affection for the super successful program and super successful tenure ahead. Thank you so much. God bless you.
Thank you so much, madam, for joining and blessing. Because as I said, I always know that you are there supporting us, encouraging us all the time, and being there in spite of, I know it is the last phase of that life skill webinar today. Thank you so much for joining, ma'am. I am indebted. Thank you so much.
God bless you, Snehal Ben and team. And so may I ask your permission to just leave?
No, ma'am, I understand you have a CHA webinar, and I appreciate this visit. Thank you so much.
Thank you. Equity.
Yeah, same. આપણે 5 મિનિટમાં ચાલુ કરીએ. ભૂપેન્દ્ર ઇઝ ટ્રાઇંગ કે YouTube. અને હું ગીતા મેડમને ને એમને ફોન કરી લઉં. I think they have not joined yet.
આમ તો આપણે બિફોર ટાઈમ શરૂ કર્યું છે એટલે
હા એટલે બીજા 2-5 મિનિટ.
તમારો મેસેજ જોયો એટલે જ પછી મેં જોઈન કર્યું.
ના I will just make a call. મેડમને ને સરને કહી દઉં એટલે જોઈન થાય. I'll mute myself.
Geeta Patel madam has joined.
Welcome,
Good
Geeta
evening, madam.
I was just calling you.
Yes,
Good evening, Dr. Geeta.
Yes,
Yes,
sir.
ma'am.
Good evening, sir. Srinivasan, sir. He has joined.
Thank you. Yeah, you only sent me that. Thank you.
Good evening, ma'am. Welcome.
Good evening. Good evening.
Wish you all a happy Guru Purnima day. You're all great teachers. So wishing you all the best.
Sir, you are a master teacher, sir.
No, I don't know. I am always your admirer and consider you as my teacher.
This is little newer topic so far not discussed. So good evening, Ketan Shah, sir.
Good evening, ma'am.
Good evening, sir.
Namaste. Guru Purnima wishes to you all, ma'am.
Yes, Krishna Pandya. I think I saw her slides are really good.
Yes.
Thank you, ma'am.
Good evening, madam. Dr. Jaimin here.
Good evening, sir.
Yeah.
I think that day meeting you were not there. I think you were busy in surgery, no?
So, emergency and then surgery back to back.
So it's 9. So I think we shall start our today's webinar. So here with I welcome all of you for 6th episode of CRISP webinar series. And madam, is that okay that we shall start?
Yeah, I just shared a link with Dr. Pemde, sir. Let him join. He should join in a while, I guess. He should join us. I just shared him a link.
Yes, madam.
He was not finding it, so I shared it again. Let us wait for a minute or two.
Yes.
ત્યાં સુધી એકવાર સ્ક્રીન શેર કરીને જોઈ લેવું છે?
Yes, madam. No issue.
Is it visible?
Yes, madam.
Okay. Then I stop.
Yes.
Huh? Perfect, ne? Huh.
Yes.
Okay, then I stop sharing.
ઇન્દ્રભાઈ તમે પણ જરા શેર કરી લેજો સીવી માટે મને જોઈશે હા તમારું.
મારું રેડી છે.
Karishma is here now. Welcome, sir.
So today's episode of CRISP webinar series that is sports for health, and confidence. I hand over to our episode in charge of today, Dr. Ketan Shah sir, for further proceeding. Dr. Ketan Shah sir, I am sharing this screen now. You can go ahead.
Good evening, everybody. My regards and best wishes on the auspicious day of Guru Purnima. All doctors, all teachers, my regards. And today's topic is on sports. and sports has been the passion for many doctors also. And this is for the adolescent health, sports is very important. We have a Dr. Snehal ma'am. She's the chairperson of Gujarat Academy of Adolescent Health, and she's going to moderate the session. She has been the past President Academy of Pediatrics Baroda and President Academy of Pediatrics Vadodara in 2024. And she has been Executive Board Member of Gujarat and Central Zone AHA. Her special interest is in adolescent health, vaccination, and respiratory medicine. Next, please. Dr. Geeta ma'am, she is very well known in India for her adolescent activity, and she is an adolescent health specialist and counselor, Chaitanya Hospital, RT Nagar, Bangalore. She has been a recipient of Fellow IAP awardee, and she has been the member of Central IAP, Central AHA chairperson in 2024. And she has written so many chapters and chief editor of IAP AHA textbook of adolescent medicine. Next, please. Professor Harish sir, we all know he has been a mentor and teacher in academy, and he has various publication. He has been a chairperson of IAP Child Abuse, Neglect and Child Labor Group also, and has been an advisor in so many groups and association. Dr. Jaimin sir, he's an orthopedic. He was the professor in SSG Hospital, Baroda. He has been in Surat also, and he has left only spine for surgery. Rest of the joint, he is specialist in the knee, in the shoulder, and the hip arthroscopy, and expert in subvastus CR knee replacement surgery. Our next is Dr. Utpal sir. Absolutely fantastic personality. He's joining as a parent and a very active personality as a director, trustee in so many association. He has been a president of Association of Self-Finance Schools. He has been a convener of Junior Run by Baroda Marathon, and he is a core committee member of Vadodara International Marathon also. He is a part of the task force member in many legal activities. Krishna Pandya, a very important personality in Gujarat. She has been a swimming coach of Gujarat Sports Authority, and under her leadership, so many students has been trained, and they were represented at Olympic level also, at national level also. So I hand over the session to our moderator, Dr. Snehal ma'am.
Thank you so much. And I welcome all of you as Chairperson Gaha. And I thank all my panelists for readily accepting the invitation for such a wonderful topic. I share my screen. Okay. Is it visible?
Yes.
Okay. So, welcome all. And today's our topic is sports. Sports for strength, health, and confidence. Is it moving? Okay. So before we go on to main topics, let us understand where India stands today in sports. So the India's performance across elite international competitions has broken historical records in last 10 years. The nation went from winning just 4 medals at Rio Olympics 2016 to almost 29 medals at Paris 2024. India also breached the historic triple-digit mark at Hangzhou 2023 with 107 medals. And at present, there is Commonwealth Games going on at Glasgow, Scotland. We have already won 12 medals and we are ranked 8th in the position with 2 gold. One of them is from Paralympics, 7 silver and 3 bronze. 2 of them are from Paralympics. So not just medals, the explosion has occurred at sports economy also. We all know IPL and Kabaddi Premier League. There is a rise of women's sports. We have witnessed in Women Premier League. And there is institutional and manufacturing overhauls also. There is a shift from unrecognized talent hunting to data-driven infrastructure like in Hello India. We have become manufacturing powerhouse. Jalandhar and Meerut are manufacturing hubs for indoor sports, and it is scaling rapidly with Niti Aayog projecting sports equipment exports to hit almost $8 billion over the next decade. So today's sports are no longer just a hobby. They are becoming a way of life, a career, and for many young people, a dream. Yet behind every medal, every trophy, and every standing ovation lies a journey filled with hard work, discipline, sacrifices, and sometimes injuries, setbacks, emotional stress, and difficult decisions. So he is responsible for helping a young athlete succeed. Is it the parent who offered unwavering support? Or is it the coach who shapes skills and discipline? Or is it the pediatrician who understands the growing body and mind? Or is it the orthopedic surgeon who helps an injured athlete return to the field? We know the answer is we need all of them. And that's the reason we have such a fantastic panel. A champion is never built by one person, it truly takes a team. And that is why today's panel is so unique together, each bringing invaluable experience from their own role in a young athlete's journey. Together, we'll explore not just how to create better athletes, but how to nurture healthier, happier, and resilient children through sports. So let's begin the exciting conversation and let me introduce my panelists. We have Dr. Geeta Patil ma'am and Dr. Haris Premde sir as adolescent health expert who will be giving us adolescent health related and mental health related insights. We have Dr. Jaimin Jaisalpura who is expert orthopedic surgeon in sports medicine. Ms. Krishna Pandya has joined as coach and you must have heard about the accolade she has received. And we have Utpal Shah sir, who is himself is a legendary person, but he has joined us today as parent of Manusha, who is a TT player, and we know him as Olympic athlete. He is 3 times bronze medalist in Asian Championship. He is ranked second in doubles, mixed doubles, may fifth, and individuals ranking is 40th at world level. And I'll be moderating Dr. Snehal Sheralwala. So the structure of today's discussion will focus on how sports help in the development, role and responsibilities of stakeholders, few issues related to sports, key messages, and concluding remarks. So the first question is to you, Ms. Krishna. What are the basic qualities of an ideal player? Krishna Mel.
Thank you. The first is the physical foundation. Basically, the fitness of player that comes to the basic motor ability like speed, their agility, the conditioning, uh, that specific demand in the sports that base, without that base we can't found that the most gifted players even break down before that load. Second is, from my opinion, is technically the mastery, the drill they are doing. Of course, I'm from swimming, and I would like to give example of Michael Phelps. Actually, everyone knows. He used to he visualized to be the champion. So I think that technically that's a coach responsibility actually. But when you are doing again and again the same thing and you are not be tired, that's the second thing actually coach need to identify that player. Third one is I would like to say the mental strength. આપણે બધા વાતો કરીએ કે હાર્યા પછી જ એ જીતવાની શરૂઆત થાય છે. સો ધ થિંગ ઇઝ વેન યુ લર્ન ટુ બાઉન્સ બેક, યુ લર્ન ટુ ધ રિયલ વર્લ્ડ, રિયલ સિચ્યુએશનને ફેસ કરતા શીખે. That's the third one, that how he or she is dealing with the lose match, or how they come back from the emotional setback or from the matches. Then fourth one is coachability, sportsmanship, of course, that discipline. And when I would like to say ki, a player who shows the time, that take a feedback without an ego, respect their teammates and all. That's a natural things, that's gifted naturally, I think. If that players have that these things, then I can say that's a ideal situation, and ideal player things that I would like to identify. Because when I'm thinking about the an ideal player, I don't start with the talent, because talent is just a entry ticket. So many of our like have talent, but when actually decision for the young athletes goes to the distance come down, for that things are actually with the physical foundation, their mental health, their technical things and build up, and of course the discipline. Thank you.
Okay. So points well taken, not only physical, but technical, mental strength, resilience, and everything is needed, not just talent in that particular field. So, Utpal sir, as we discussed all this, where did how do you support your child's involvement in sports, morally, socially, and of course, financially as well? So, over to you, Utpal bhai.
So I think I will start the last one the first. How do we support? Uh, uh, to be very honest, thank you, Ketan bhai. On a special day of Guru Purnima, you have awarded me a degree of doctorate, but I am not a doctor. I am a chartered accountant. Like anyway, uh, see, in any sports career, initially, obviously, parents will have to support them financially. But the way government now encourages the sports as a career, we have different schemes of state government, we have different schemes of even the central government, which includes Shakti Dut scheme, TOPS, that is targeted Olympic players. We have different foundations from corporates like OGQ, Virat Kohli Foundation, Go Sports, Reliance, Adani. All of them supports the sports person in pursuing their career. So as of now, I can very confidently say that finance should not be a problem for any talented player. Second point about the socially, how do we involve the sports person or our children? That becomes little difficult because most of the time, once they are into the national level tournaments or coaching camps, most of the time they are not available to attend most of the social events of our families also. But that's a part of it. That sacrifice we expect and we will have to give it to them. We connect them through social media connections, phones, and everything. So they feel that they are not physically present, but at least virtually they are available. And with respect to the moral support, I think sportsmen do need to have a sportsmanship. And moral support would actually require us to support them. There is some kind of injustice to them, which very often happens to the sports person in terms of selection criteria and lot many other things. So that's how we we support them in taking up the sports career. Thank you.
Great. So, like CA, from CA expected finances came first, but it was very
હજી કેમ નથી હજી અટકે છે
it was
નથી
very
વાઈફાઈ સરખું
interesting.
નથી આવતું કેમ
Some
કેમ
everyone
નથી આવું ઓમ 100% દેખાડે છે પણ ઓમ અટકે કેવી શું કામ તો what is this
everyone is requested to mute themselves, please. Those who are not speaker are requested to mute, please.
I have muted, ma'am. Go ahead.
Okay. So it is wonderful to know that we have so many skills and finance is not a restraint. And now we come to a role of pediatrician. So what is the role of pediatrician in the sports journey? And how do we monitor the growth and development, Gita ma'am? So we assess the physical fitness in young athletes. Over to you, Gita ma'am.
Thank you, Dr. Snehal, and thank you, Gujarat AHA, for giving me opportunity. Thank you, Dr. Sameer ji. And I think we are definitely supporting a Fit India, Khelo India movement, which is launched in 2019. And pediatricians play a major role always in the physical and mental health of a child and adolescent. Why not in sports? We have taken an oath that we are going to look after their holistic health. So very important, the pediatrician's role is in the entire journey, in the screening, monitoring. We honestly should counsel during their puberty time, and partnership with families, coaches and specialists is very impactful. Very important thing, we ourselves have to know blindly we should not do the thing. And previous slide.
Yes, ma'am.
The sport readiness doesn't depend on the chronological age, because every child and adolescent will be in a different maturity stage. So important is neurodevelopmental, cognitive and psychosocial maturation as well as the puberty. So that is a very important aspect, is sport readiness, to assess and match that sport with that ability. And then very important is advice about the injury prevention, helmet, pads, then mental health screening, which will be discussed very much because sports has got a mental health problem very much. And always monitor the child as a whole, not only athletic but academic, developmental, because we know that this is a very unique stage, because in the adult players there is no development and growth, but here you have to look after that also. And always encourage both structured as well as unstructured play. And when you go for a school health program, always I talk to them and tell, don't skip play for academics. So monitor the child and give them a lifestyle education about the nutrition, diet, medications, doping, media influence. All will be discussed now in the next few minutes. Next slide. So very important is match the readiness to sport, not only the talent, as already Krishna madam has told. So future excellence doesn't depend on the childhood. If you start early that you will excel, is not like that. It may lead to burnout, injury, dropout. And encourage both males and females in every sport. You have seen a Dangal movie. Ladka ya ladki, gold medal ही रहता है. That is very important. Guard against a win at any cost, because parents expect that sports they will get a quota in some medical college, engineering college, they will get a scholarship. There is a peer pressure. Coach also will be pressurizing. Next slide. Next slide. So it is very important for us match the sport to the all these neurodevelopmental, cognitive and psychosocial maturation, without going into detail because that will be a topic on its own. And I already told, don't tell that sports specialization should be done in the early age. And the effect of that I already explained. So expose the children to varieties of sports as a fun, as a physical activity. So this is very important to monitor the growth and development. Next slide. So very important. Next slide, ma. So the part to play, developmental milestone. See, you know that child can sit after the neck holding only. So everything should go step by step. At the age of 6 to 7 years, they understand to compare themselves with their peers. By 8 to 9 years, they grasp the concept of competition, And by 11, 12 years, 11 plus only, we say physical and psychological skills to competitive environment. And obviously, we know that early, mid, late adolescent, their physical, psychosocial, emotional, sexual changes are there. And according to that, they will think, like I am giving an example, mid adolescent, there is a lot of peer pressure. They don't have realistic expectation, just abstract thinking has started, and coach is very dear to them. But by late adolescent, they realize that what is a reality. The next slide about the puberty. Some of them are early bloomers. They become a superstars in the sports, but only 25% of those superstars persist to be superstar once they start competing with the other peers by the time they catch up. And there are late bloomers, so they will have low self-esteem, less confidence. We have to reassure them and give alternate activities. These are two very important points. And then very important is, all of us, we know that there is a musculoskeletal disproportionate growth. So during this growth, you know that limbs are longer than the body. So they are very prone for musculoskeletal injuries, stress fractures, sprains. Then important is Tanner staging, very important, not chronological age only, because post menarche fat increases but strength becomes plateau. All of you know that in a girl's growth spurt stops 2 3 years after menarche. So we have to give a appropriate advice or guidance. So our role is very important. I want to highlight, and all these aspects will be explained in the next by all our speakers.
Thank you, ma'am. It was a wonderful insight, and it becomes an important that pediatrician has a checklist of all the important points, not missing out on the growth mismatch as well. So, coming to Dr. Pemde sir, what is the role of mental health in sports and how can it be assessed at different ages? All of us talked about mental health. Now, please guide us. What is the role of mental health in sports?
So thank you, Dr. Snehal, Dr. Sameer, and all the people at Gujarat AHA for giving me this opportunity. I will be very, very brief. And I think by now we have understood well that champion is built not only by muscle, but also by the mind. And mental readiness is as important as physical readiness. And at times, this becomes the difference between the winning and losing team. So mental health influences motivation, concentration, decision making, and resilience, which is so important in competitive sport. And emotional maturity develops gradually, that we all understand. And during the puberty, also emotional maturity comes gradually. And we should avoid expecting adult performance from children. That is very, very clear by now. Several speakers have talked about it. Next, please. So this is age-wise readiness we can expect from children, and early age sports should be a fun. They should learn movement skills and no pressure to win should be there. And 10 to 13 years skill development has to take place. They should learn how to work as a team, how to handle failure more than the handling success. Both are very, very important, and positive coaching is required. For older age groups, 14 to 18, competition increases at this time. We all remember Vaibhav Suryavanshi is just 15 years old and playing in national team. So identity becomes linked to your performance, and there is a great risk of anxiety, burnout, and depression at this age group. And we need to screen for mental health in this age group as a routine. So the right competition at right age prevents both injury and psychological burnout. This we should remember. Next, please.
Sir, next.
Okay. So this is very, very important, that mental health is very important, right from preparing them, increasing their motivation. So we have to deal with them accordingly at different age groups as per their mental maturity. But mental preparation is equally or rather more important than physical preparation.
Yes, sir. I agree completely. Mental maturity is more important, and with increasing problems with handling no and mental burnout and not coping with the failures which was never seen before is a big issue.
And then Dr. Snehal, those who are involved with the children at this level, they should also understand and remember the brain development and psychosocial development during 10 to 20 years, which is very, very important. Because if we know how they get influenced and what kind of a vulnerability they have, we can modify our dealing with these children. So sometimes they should also understand the how the amygdala develops, how the prefrontal cortex develops. So that is a basic understanding they should have. Thank you.
Agreed completely. So coming to the next question, it comes to you, Dr. Jaimin. How can physical fitness be built for different sports? And what are the age appropriate tips? And what are your recommendations for regular workouts and exercise readiness? I know two questions in a row, but I'm sure you'll play it like Suryavanshi sir just mentioned.
Pleasure. First of all, thank you so much, Snehal Madam, for organizing this. Thank you, Ketan sir, for your invitation. And first of things, what is a physical fitness means? So now a lot of kids comes to us as an orthopedic surgeon, and they have fall with any different sports. And when you ask them, they go for gymnasium. They are very crazy about gym. So majority of times they think there is a bodybuilding which is related to the physical fitness. So that conceptualization, and as Geeta Madam also told, as a pediatrician, now we feel that we should send back them to you or to the psychiatrist for a proper counseling. So that is the first thing practically what we face. To be physically fit, the most important thing is there are four fundamental pillars. And when we give any fitness tip, we always ask them to go for the core stability. That is most important in your kinetic chain. So core stability, body weight mastery by doing just push-up, pull-ups, lunges to build their relative strength with the body weight only, particularly for kids, and mobility and flexibility. That is one more important thing we should focus. And the last thing is coordination. So these four pillars: core stability, body weight mastery, mobility, and flexibility. Along with that, coordination. So this plays a major role for the physical fitness to achieve. Now, every sports requires a different level of fitness, of different body part strengthening, stretching abilities. So if you think of court sports like football, basketball, or tennis, so they require agility, plyometrics. So what I mean by that is, plyometrics is like low impact box jumps, if you can imagine that, or use skipping. So this is very, very basics of plyometrics. So this is what they need to do. If we think of swimming, Krishna Madam is there. So you need to strengthen your posterior chain, more importantly, to strengthen your glutes, hamstrings. So different sports requires you. Again, if you think of running, cycling, then it's a basically aerobic base. So here you requires good endurance and structural strength both together. So that's how you have to, which sports you are focusing. You have to master your fitness for that. And to be on a safer side, there has to be a rule of 10%, which is a fundamental rule which we follow. And we ask all our physios to follow that as well. So never increase the training volume or intensity by more than 10% a week. That is most important. And of course, being a kid, you need to give sleep a good priority, 8 to 10 hours of sleep, which is very important. And for any athlete, you don't increase the resistance while they're training. Not beyond, again, I'm getting by 15 repetition of body weight. If he is able to do it more comfortably, then you go with the increasing the stress on the joints or the muscle, and you can increase the load. So I feel for a physical fitness, first is your core stability, flexibility, and then which sports you are targeting with your coach, and your one step ahead, strength and conditioning coach are still there. So you can consult them along with the sports physiotherapist. So there is again going to be a team. So then you can perform at your best. And now the second question regarding your regular workout and exercise, I will be slightly brief on that. But we always believe we start with uh, workouts very अर्ली कि चलो हमने सोच लिया कि ये करना है तो लेट्स स्टार्ट फ्रॉम टुमारो सो फर्स्ट यू नीड टू सी दैट योर बॉडी इज रेडी टू फॉर दैट वर्कआउट और नॉट so most importantly your baseline movement qualities and your safe progression, it relies on your mastering again body weight control before going for any external resistant exercises. So for that I'm coming back to squats. We all used to sit cross-leg squat in our childhood or in your regular life long back, 30, 40 years back. So regular baseline squat, plank hold, single leg balance, like we are hoping and all play we have played. So that is most important. Push up. So this is all we have done in childhood, in school or in basic uh, on playground. So that is most important. Your body is athletic. And then you start with the structured workout. So structured workout can be focused or divided into 4 parts. One, dynamic warm-up. Any exercise you need to do warm-up. Then strength and movement foundation. Then conditioning and agility. And last, cool down and flexibility. So this is just brief. We all should be knowing rather than directly when any kid comes to us or any player comes to it, don't jump directly to the play. You warm up, do exercise, do drills, sports specific drills, and then you get involved in your sports. So I feel this basic criteria should be matched. Thank you.
Perfect. Message well taken, Jaimin bhai. Strength, stability, flexibility, and stamina. So all four has to be there, and we must pass it on to the athletes or sports person we are meeting. So coming to Krishna Ben again, do you think India has an ideal environment for sports and development? And what are the hurdles and positive points according to you?
Thank you. Uh, Honestly, I would to say that we are say moving towards right direction. Then I would like to say yes, but we are not there yet. I want to be balance both the sides of this. There are like major hurdles that's at the grassroots level infrastructure. The biggest one is still infrastructure outside the big city, and the talent child is in the small town or in the village, often does not have access of proper ground equipments, qualified coach nearby, or the gap in the access of means like we lost the talent before it's even discovered. The second hurdle is the shortage of trained coaches, uh, and of course the trained sports science team, uh, like physiotherapist, nutritionist, that psychologist. Uh, when we are making an athlete at the elite level, everyone wants to go for the high level of training. No one, even not the coaches, the good trained coaches or the experienced sports science team, want to do work at the grassroots level. That's uh, the biggest hurdle, I can say. Most of the coaching are doing the job of 5 people, like everything. The sports science team are taken care by only one person. That's a I think scientifically development of coaching we are discussing, and that's a lack, I think. But the positive side is that environment genuinely improved for the healthy competition from the Khel Mahakumbh. I think Khelo India window, that's a grassroots level. for the young athletes, that's a real pathway. I think that scholarship structure, composition, Utpal sir said, like that, that's amazing. Uh, Public investment, even PPP model is developing. That that is also good. Even positive signs are like professional leagues are now going on. So the private academies to the multiple sports, not only just like a cricket. That's a very important, uh, that new generation of Olympic and Asian games medalists who are inspiring parents to see sports as a genuinely career, not only like just a hobby, as sports as a hobby. So my honest answer is ecosystem is improving. Yes, it's too fast at the top level, but real work now is carrying the same energy level towards downwards at the district and village level. That should be we are lacking there. Thank you.
Yeah. So, Utpal bhai, after listening Krishna Ben, I ask this question to you. Say, how should parents, schools, because you are a trustee at various schools as well. So, how school, parents, society collaborate to support a child's sports journey?
I think parents plays a pivotal role in permitting the children to pursue their career as a sports, because in Indian environment where academic is given such a high importance that probably a child, even if he is doing good in sports, parents and surrounding society, including the nearby relatives, peer group, will all say that what will you do, or rather what are you doing, apart from playing. That is a very common question. Even people are asking to me also, and even to Manush, ki, fine, he's doing a national international level player, but what else does he do? So I think parents plays a very important role. With respect to the schools, I think relaxation in school attendance, examination schedules, reshuffling, and recognizing their achievements before the other children would play a very important role. And with respect to the society, to be very honest, I have not been able to observe any much significant contribution for sports which are other than crickets.
Right.
Thank you.
Very wonderful insight, and I must applaud you and Rina Ben also, because you are a CA, Rina Ben is a doctor, and still you encouraging Manush to reach such a wonderful level, commendable. So coming to Gita
Between
Ben
the
again. Uh-huh.
and between the lines, Evi check, we also had no choice.
I think putting the child first made a big difference.
Yes.
So coming to Gita ma'am, what is the pre-participation evaluation when we talk about so many things, strength and stability, and what comes to pediatrician, and what is the importance, why athlete should go pre-participation evaluation?
I think very thankful, and it is heartening to know that career option when we do career counseling, which we do as an adolescent specialist. I think sports is also a career to be selected. And I just want to highlight one thing which maybe I don't know whether it was highlighted. Warm up is very much required, has to be highlighted.
Yeah.
And Krishna madam was telling safety for the female players is also very important, and that has to be seen everywhere. So apart from that, now let us move on to the pre-participation evaluation. Here pediatrician can play a very major role because this is a gateway to the safe sport. Just encouraging to get into sports is not enough. So it should not be done just before the sports season, but should be done 6 to 8 weeks before. So you can detect certain things which you should be able to manage also. By the time you can, like asthma, if it is not well controlled, if diabetes is not well controlled, we know now that we have to tell everyone to participate, irrespective of any chronic disease. And we know that 75% of conditions can be detected by history alone. So our goal is match the athlete to the right sport, not just go on clearing or excluding them. So it is a very important pre-participation evaluation will evaluate the potential health risk and see the safety and promote the wellness. Next slide. So very important is a key history. I think, very important history. We are very much used to the birth, developmental, immunization, allergy, but a girl child, menstrual history, and never to forget teenagers' heads. We get a lot of psychosocial screening by that. And we know that about the dietary history, body image issue, we can get a lot of information. But especially the sports pre-participation evaluation, never forget to ask the recent febrile illness, because during the game it may cause it, there is a chance of myocarditis and sudden death. Head and neck injury, how the treatment is taken. Exercise induced breathing problems, I think we give medications, inhalers. Then musculoskeletal injuries, whether they are all right or not. I think our orthopedic surgeon has already told that we have to be very cautious. Heat illness and some single kidney or horseshoe shaped kidney, all are very important, but never to forget the symptoms of cardiac disease like a syncope, chest pain, and never forget to ask, when you ask family history, we should ask the history of cardiomyopathy or sudden death below 50 years. And physical examination, thorough physical examination. We know the anthropometric measurements, how to evaluate the vitals, sexual maturity rating, visual acuity, or any other systemic problems, or maybe skin infection may be there. So it may cause infection to others. Genitalia, hernia, inguinal nodes. Very important, you should screen for Marfan syndrome also. We know that arm span and height, what is the proportion, because they are very much prone for aortic dissection. Then cardiovascular signs, murmur. I think nowadays we are used only ECG and echo, but here you remember when the child or adolescent is standing in obstructive cardiomyopathy, many of them ask, it increases the intensity, and when they are squatting it decreases, and reverse in aortic stenosis. So these are the simple clinical things which we can detect. Next slide. Next slide. Okay, so medical eligibility decision is very important when you are doing this pre-participation evaluation. That is a topic on its own. I'm just giving an overview. You can ask the question so that it is not harmful to he or she or to the others, or we can give some management with eligibility with the recommendation. I already told that mild, well-controlled asthma, diabetes, epilepsy, sickle cell trait, or corrected vision, because vision is also very important. So single kidney, we can give them a appropriate guidance. Apart from that, there are certain games, few games only are allowed. So there are four categories for clearance. One is totally no restriction. Second is, madam, last slide. Before that slide. Okay, eligible with the recommendations, what I told. Eligible before slide. Before slide. Just go back, ma. Okay, this is enough. I am not going to slide. Next slide, ma.
Medical eligibility decision making.
Bus. This is enough for me. So eligible for certain sports only. So this is very important, and there are certain places where no, not eligible only, but there is always controversy. Each case, should we do X-ray chest, ECG, echo, because we are having a fear of cardiomyopathy, aberrant coronary artery, arrhythmia, acute myocarditis, aortic stenosis, Marfan syndrome, long QT, Brugada syndrome. I am not going to get into the pathophysiology, but these are the conditions which worry us and we have to evaluate. Next slide. So there is a condition. Next slide. Only one category I want to highlight is eligible for certain sports only. See, like a single functioning kidney. You can do walking, brisk walking, golf, contact sport should be avoided. Table tennis, badminton, yoga. These are the things which we have to remember, eligible for certain sports and they are not eligible at all. So these are the four categories we can do in pre-participation evaluation, which is very important, where pediatrician can get involved. Not only orthopedic surgeon is enough here. So thank you very much. This is the overview of the pre-participation evaluation.
So it is a wonderful insight to know that there are some eligibility criteria when it comes to sports, and of course we must know the other factors also. So coming to you, Pemde sir, how does participation in sports impact mental health? Like we saw how mental health is important in sports. Now, mental health and development impact would like to know from you, sir.
I think it is very, very important. If we participate in any sport, this improves our mental health and well-being. Okay, not only physical but mental well-being also. So this is one of the best natural medicines for adolescents. There are several benefits for participation in these sports. This improves self-esteem, reduces anxiety and depression. It leads to a better sleep, better emotional regulation. Actually, we provide them to experiment and put into themselves into vulnerability through a supervised sports. Okay, so they are under a supervision, so they can better develop themselves, better emotional regulation. It can improve concentration. Definitely, they build lots of friends. This also teaches discipline. So, if you want to become a good player, you have to be very, very disciplined person. And after all, this reduces screen addiction because they do not have enough time for screen addiction when they participate in these sports. So, for example, if you are a cricket team doctor, you can say that happiest dressing room often performs better than the most talented dressing room. So, if the team is happy, they will perform better. But participation in any sports may not be competitive sport. It may be some simple sport playing with friends in school or outside school. This is very, very important. This improves your mental health, whether you are a normal person or even if you have some disease. I have seen that there in our psychiatry ward, they have some badminton courts and other sports facilities. So even the people who are having some chronic mental health condition, participation in sports help them also. Okay.
Right. Fine. Thank you, sir. Jaimin bhai, you have answered this before, but do you want to add something to what are your recommendations for regular workouts and exercise readiness, which you felt that you missed before telling us?
No, madam, I would like to add on that there should be professional help should be taken for every child. If the parents are feeling that they want to go ahead sports as a career or they want to take it more seriously than a routine sports, so you need to have a professional counseling like a pediatrician or sports and conditioning, strength and conditioning, and sports physiotherapist. That is the only thing I think we should emphasize again on it.
Right. Thank you. Now coming to Krishna ma'am again, what is the ideal age to start competitive sports? We saw the path Gita ma'am has given. Where do you feel that parents should think about getting the child into a competitive sport?
Yes, actually, Geeta ma'am and sir is covering all covering that the section. I am totally agree with that. Against the rushing the child for the training, uh, we should have to identify their interest of field. So the thing is, uh, uh, different games have the different starting time. Early identification of that talent. Somewhere the new coaches, new trainers are like early over specialized. That harm than good. Actually, that is more harmful to train them, overtrain them, or that leads them to burnout or overuse injury. So the thing is, when we are talking about that swimming or that skill-based gymnastic, you can start with the 4 to 6 years old because that's a technical demand of that sports. If we are talking about the team sports or combat sports that usually start with the letter identification, or that at the age of their developmental age. So I can say that foundation of the sports, that for the training, that should be between 6 to 10 for every sports. That's a common area. But for the where that the skill is important, that should be start from the early, like even I think for racket sports. But that's not training perspective. The foundation should be there at the age of 6 to 10, and the development for the specific technique and the specific sport should be 11 to 14, or that uh, could be the developmental. What's the their
Point well taken. Yes.
Yes.
Should
And the
certain
specialization should be, of course, by the before that 15, that should be identified actually.
right, right. Okay. So, Utpal bhai, can you tell us how does the sport participant has contributed to Manush's overall development, at different life stages, maybe child or maybe adolescent and now young adult?
I think Dr. Pembre sir, what he said about the discipline, I would completely agree with him that the first thing that we observed in any sports person at any level of playing, the discipline is something which we observe, because without discipline, a person cannot reach to any level. I am talking about the sports career. Then probably the difference that we find in a sports person is, rather than sitting on a sofa, or rather than having a full focus in digital contents, mobile phone, laptops, probably they are spending more time on physical activities which keeps them fit. The third thing which I have observed them is developing a teamwork, because most of the time they are playing and representing India as a team and not as an individual. So that develops a team spirit. The fourth thing is self-dependent, because most of the time they are away from the home, which in case of Manus, I can say almost 10 months out of the 12 months, they have very less dependency on the families and they have become very independent at a very early age. The most two important things I would like to identify, being identified as a sports person, is to digest the defeat and stand up again. See, these children are playing in a different categories, even in the same sports, like individual category, mixed doubles, doubles. Even if they have been defeated in one category, they might be required to play in another category within half an hour. So to digest the defeat and to stand up again with the same spirit is something which is very important for them, and that we have been seeing in most of the successful player. And the last thing is to face the criticism. It hardly happens that you win all the time. So when you don't win, you have to face the criticisms from a lot many people. And then people start telling, who told you to go for a sports career? So managing that frustration is something which is very important, and that is being there if a person wants to take up sports as a career. Thank you. That's all.
Thank you. Now we have 15 minutes for our next few questions possible. So I would like to ask Geeta ma'am, can you please share us some recommendations for nutrition, diet, and medication for young athlete?
Yes, I think it is very important. Next slide. Nutrition as growth and development is important. Obviously, nutrition is required for that. Next slide. So nutrition, very important. The experts are here. They can tell us before that, ma. Before that. Go previous slide. Previous slide, ma. So this is enough. So most effective way to, next slide, effective way to have a optimum nutrition for getting a better backside, ma. Go previous slide.
This one? Diet, eat well, and
This is
stay
enough.
hydrated.
This is enough. This is enough. This
Yes.
is the slide. So very important is this slide is little crowded, but it summarizes everything. The most important thing we have to remember that optimal nutrition for achieving good physical performance is a well-balanced diet, which gives us sufficient nutrients and calories, and which are required for the metabolic demands as well as growth and development. So intense physical activity definitely increases, it does not increase the specific nutrients. Definitely water, electrolyte, calories are spent little more, and we have to remember about that. Energy requirement in teenagers is variable because their size, their body composition, stage of sexual maturation and rate of growth is different. So if there are two teenagers, if they are in similar activity, can have a different energy requirement. So it is very important. I am dividing the sports into two categories for our purpose. Less than 90 minutes is non-endurance sports. We know football, swimming, gymnastic, dance. Nutritional demands are not more than the demands of growth. But if it is more than 90 minutes or endurance sports where marathon running, road cycling, triathlons, their need of special diet and fluid intake is very much important. What we have to concentrate is improve the lean body mass, and good nutrition, proper training and proper rest is important for the peak performance. We have to remember very well, eat well, stay hydrated, because we say that protein requirement is 1.2 to 1.7 gram per kg per a sport athlete, and which is routinely 0.8 gram, which can be compensated by adding in the diet rather than giving a protein powders. Protein powder replacement is not required because intense exercise increases the protein utilization. So please remember that water should be taken regularly at regular schedules, so which will avoid the exhaustion. Can have a cold water with simple sugar. It will empty the sugar empty the stomach very fast. Sport anemia is a very important. Teenagers are very prone for anemia, and it happens because of hemodilation and dietary deficiency. Calcium is also very important. So it is a very important, again, eat balance, stay hydrated, perform better. Next slide. So next slide. Next slide. So don't change it. See, many times they ask us what is a pre-competition meal. 2 to 4 hours before, you can have a mixed diet, regular diet. Should be high carbohydrate, low in fat and protein, because it will empty the stomach early. So we have to support them. And hydration is the main important aspect in non-endurance sport, which we have seen now. And carbohydrate containing fluids are important in endurance sports. So very important, pediatrician can play a role. We always talk about the nutrition. So we have to screen at every visit about the diet, weight control activities. So some of them have got a body image issue. They take an unhealthy diet. Guide them for a sports like obese athletes. We can tell the swimming, cycling, basketball, aerobic circuit activities, and refer them wherever it is required. But our aim is mainly energy availability is very important. That is a foundation for that female athletic triad or menstrual and bone health problem. Support the bone health by giving 1,300 milligram per day calcium very religiously, to give a vitamin D 600 units. Avoid the hypertonic fluids in the 2 hours before the activity. Next slide. Next slide. Next slide.
It is there, ma'am.
Next slide, ma. Next slide. Next slide.
Medication and supplement portion.
So I am. This is very briefly to be explained because this will be taken in different things also. Here I'm just see, we have seen the nutrition, that well balanced diet is the most important thing, and in your own diet you can do the things. So dietitian is very important here. So apart from that, this supplement is big no. Protein powders or these unproven supplements and performance products not to be used. We call as a nutritional ergogenics, which will be covered next by one speaker. Creatine, caffeine, ginseng, amino acid powders is not advisable. Please remember beta blockers, which improve the reduces the anxiety which is banned by the International Olympic Committee or anti-doping agency. So it reduces the exercise capacity many times, no, because when they become anxious, when you go on the somewhere to talk or to play, they tend to take it, but that is banned and that should not be taken. Antihistaminic, we know that it causes drowsiness, reduces the reaction time, but please remember, in the hot weather, because of its anticholinergic action, it may cause a heat exhaustion. So this is very important. NSAIDs, because painkillers are taken before the pain starts. So it masks the injuries and the injury may increase. I think orthopedic surgeon will tell that prophylactic use of painkillers should not be done. They have got its own side effects like kidney, gastrointestinal complication, delayed tissue healing because you allow injury to happen. So this is the brief about the what medication to be advised. Obviously, there are many other medications are there, but these are the commonest thing what are taken by the sports people. So pre-competition meal and all the things I explained. Thank you very much. Nutrition, well-balanced diet, that is our mantra. Next.
So coming to temperature, would you please, emphasize, we talked about diet and nutrition. So what is the role of an adolescent pediatrician or a counselor in preparing athlete for competition? Because we said mental stability is really important. Facing the defeat is important. Resilience is important. So what is your take, sir?
I will be happy if a pediatrician is given such a job to prepare athletes for sports. Okay, I don't know whether this is being currently done or not. But mental preparation begins much before the actual match day. We all are very much aware of it. And some important aspects are there, like goal setting. Team has to visualize that yes, this is the match day, a big day is coming. Positive self-talk has to be done by the players. Match simulation, that is a practice is very much important. And we know that all the good teams, they practice a lot. And for some anxiety related issues, some stress breathing exercises should be done. And important thing for children at least is the maintain routines. So the real match should also come as a routine practice which is happening. And they should get adequate sleep. And whatever way we can provide them, in confidence building measures should be adopted. And for younger athletes, parents should praise efforts rather than only the results. This is very important for every parent that they have to praise the effort irrespective of the result. We all want good results, but yes, we have to praise the efforts mainly. So confidence comes from preparation and not from just wishful thinking. So preparation, that is very important. Physical preparation and simultaneously psychological preparation is also done for the match or for any other competitive sports. Next, please.
Yeah, that is what it is. Yes. So coming to Dr. Jaimin, can you say how should sport injuries be prevented and managed? Because we talked a lot about physical and mental preparation. Now let us come to injuries and prevention.
Okay. So as a sports injury specialist, it's very important questions to me. And let us first go through the sports injury prevention. So first is a pre-participation screening, which is the most important, what Dr. Geeta madam spoke about. So there has to be, it was all about the medical pre-participation evaluation. So that has to be done. That is one thing. And there are different programs which are available now. Why these are important? Because we see almost 80% cases of ACL tear, that is your intercruciate ligament tear. We see almost if sportsman has not prepared well in those seasons, there are 50% chances of injury. And these are multiple injuries because these are kids. So they have got puberty spurt, they are overweight, obese, not well trained professionally. So this all we see day in and day out. Many of them represent to us with recurrent patellar dislocation, osteochondral fractures. This is all what we see regularly in our OPD. So FIFA has already given 11 plus program for injury prevention, uh, which is mainly focused on core stability and cutting alignment. Then there is another program by injury prevention and enhancement performance guidelines, which gives you more of ACL protection and the landing mechanics. Then you have knee program from Australia. So there were deceleration, how to decelerate when you are having high energy games like football, kabaddi, rather than football, I would say, or badminton. Then what is ankle and hip stability role? So this everything is well mentioned in this program. So uh, even as an orthopedic surgeon, we all, we have focus on the techniques of operating, getting back them on road, but there is still prevention is still lacking a lot in India. So in last ISACOS, which is held at Munich International Conference, and there is a president has specifically has declared that across the world we would like to implement this injury prevention program. So that was one of the motive, and it was given 20 minutes for that program. So this is what as a sports specialist the next step we are focusing on. So one is a pre-participation fitness evaluation along with the pediatric evaluation by a pediatrician, and these programs will definitely help to reduce the sports injuries. Second thing is a management. So in the management, we all know the one is on field, on ground management. So now over last 10, 15 years down the line, we are affiliated with a lot of sports academies. So whenever there is a national game or the state level game competition, we always be a part of that game where you have got on-field doctors available and transport available, which is very much important, particularly for spine injuries, cervical, back injuries, dislocation. These all we have managed, what I am speaking about. So it is very important for a medical team to be there on ground for the management. Now, basic management, we all know the price, protocol, the protect, elevate, compress, and uh, then you educate, you listen to your body. So that is the price protocol. It means you need to give elevation to reduce the swelling, avoid weight bearing, apply ice pack, and then you compress that uh, part of the limb. So that is going to give you immediate relief. And then you can give splints to mobilize this, immobilize that part, and then you transfer them to the hospital. And that is very much important for initial primary management of sports injury. But let me share one more detail that many of the things, particularly in pediatric age groups, will miss only by X-ray. So as a clinician, we always examine them, ligament and instability. And once the swelling reduces, we always get done an MRI. So we always have very high suspicion of any osteochondral fracture, chondral injuries, and ligament injuries, which we do not want to miss. Because what happens within 10-15 days, the inflammatory cascade goes away, patient feels better. And if you are not been consulted by proper consultation, then they return to sports and they come back to us with a major injury later on. So this is what practically we have seen. So for parents and for doctors, one MRI consultation, MRI is a choice of investigation for them. And regarding management, getting back, I would always say that subsequently, when they become pain-free, then gradual loading of weight, keeping them optimistic, like our senior doctor just mentioned that you need to give the optimistic outlook to again participate in the sports, and it is for restoring the mobility, strength, and balance through active rehab exercise, and then let them get back to the sports. So this should be the sequence regarding the prevention of sports injury and gradual management from on ground to clinic to back to the sports.
Thank you, everyone. And in the want of time, I'll have to skip few slides I'll just take take home message. But before that, if Haris Pemde sir can take, say a few words on doping, just to a minute on it, and then we can go to take home message by each panelist. We'll have to stop the webinar in 5 to 7 minutes.
Just show my slides. I will finish in 1 minute only then.
Yes, sir.
Very quick.
Very quick, sir. Yes. Yeah.
Yes.
Here it is.
So there are several substances which are used by a student for increase the performance. Next slide, please. So most important thing is anabolic steroid. This does increase some performance things, but lots of harm also occur. So it is not at all recommended to use anabolic steroid. Next, please. Stimulants are also used. They are taken under the garb of treating conditions like ADHD, but they are also ultimately harmful, can cause hypertension, tachycardia, heart attack, headache, tremors, insomnia, and many other things may happen. And ultimately, athlete will be caught by doping agencies. Next, please.
Are you there? I think sir's internet connection is lost. So let us go to take home messages one by one. Geeta ma'am, please. Sir's connection is lost, I
Next
guess.
slide.
Yeah, 1 minute. Okay.
So what to do in these cases? Actually, fear-based counseling, etc., doesn't work actually. And these individuals do not respond to coercion or persuasion. You need to use some psychotherapy methods like motivational interviewing or cognitive behavioral therapy, and these things only will be helpful to tackle and to deal with such athletes. Just one final line is, I have heard a research where the athletes say if they are assured of not being caught, then about 98% of the athletes will take one or other performance enhancing drug. Okay, so they should never self-medicate. Parents also should not buy medicine from outside. Whatever they are taking before sports and during that sports life, it has to be appropriately used, and all the advised and approved medicines only they should use when they fall in. So this is from my side, Dr. Sunil.
And you can carry on with your carry home message as well, sir. So we take other messages after you.
2-3 messages.
Okay, let me find out. Yeah.
So our goal is not merely to produce champions in sport, but champions in life. That life is much more bigger than these sports, and healthy minds can create healthy athletes. Let children enjoy sports, develop gradually, and remember that every medal is temporary only. But the confidence, discipline, friendship, and resilience gained through sports, they last for a lifetime. So this should be our goal, then winning some matches. Thank you so much.
Thank you. Over to you, Utpal bhai.
I think my only message is to allow a child to pursue their dream and support sports as a career.
Great. Krishna Ben?
I would like to say that let them play, and without the team, that is not possible to ask for the medal or simply for the final achievement. Like everyone cannot be the Olympian, and every Olympian can't be the Olympic medalist. So there is only one medal. So let them play.
Right. Jaimin bhai, over to you.
Madam, so yes, as a kids, we should allow them play, but it should be safe enough. And what's my observation, biggest challenge right now is to obesity, high BMI, leg joints, and they are not, that kids are not prepared for the sports as a part of the physical fitness. So this is my worry, and this is what I see. So let us all focus like this program on more of injury prevention and preparing the kids for the right sports. Thank you.
Thank you. And last, Gita ma'am.
Okay, I think
Represent us, ma'am.
very short message. Can you go to the message? So
Yes,
very
ma'am.
important thing which we have missed as we have to proceed is a female athlete triad. I think I'm not going to go into detail. There are three important things in that. First is a low energy availability. Previously, we used to call as only eating disorder, but now it is with eating, without eating disorder, menstrual dysfunction and low bone mineral density. This happens because they want to be thin. But nowadays, newer concept is relative energy deficient in sports. It is applicable for males also. And when we are practicing, we should screen and assess them. DEXA scan is very important, and we should have a multidisciplinary reference pathway like a pediatrician, mental health professional, and dietitian should work together. And we should try to restore the energy requirement as well as weight. This is one very important thing. And second one, I like to tell is a media and sports, which is extremely important for us. Already it is highlighted that sports is very important. I want to add only one thing is it reduces the chances of non-communicable diseases. So apart from that, media, now we know that sports channels, sport pages are most popular. Media culture has created many idols and icons who give advertisements. So they have to have a sports media literacy. Eating junk, watching TV causes obesity. We know that FIFA football match, 1 month we have slept at 2 o'clock many times. And that has disturbed our circadian rhythm. Studies also for the children. And sometimes in the girls, apart from, I think we know the Sania Mirza, I don't want to talk in detail to take anyone's name. With her performance, her beauty and style is also been discussed. So very important thing, some of them lack the skill to tackle their success as well as failure. And some of these media, they have got a false narrative, glamorize the professional athletic, winning at any cost. That should not be there. Unrealistic expectations should be reduced. There should be realistic expectation. Sports success and life success, you have seen so many players, let us not talk about them. It doesn't go hand in hand. So having a realistic expectation, reframe the goal. Many times we are seen when we are counseling, we ask the middle and high schoolers. Boys especially tell they dream of being an elite player because they want money, they want status, admiration, rather than the fun of the sports itself. So we need to tell them about these things, and we can talk about the substance abuse, all the things already I have summarized. Media is very important, plays role in the sports person, and we need to know about that. Thank you very much. This is the message that pre-participation evaluation is very important. Sports medicine is just not a part of orthopedic surgery. It belongs to the primary care clinician. Sir, I'm not telling sir, but we also should get involved because
Yes.
our sports journey, everywhere pediatrician has to be or physician has to be involved. Mainly pediatrician or adolescent specialist has to be involved. Thank you
Definitely.
very much.
Thank you. In the want of time, we missed on this media part and the doping and substance abuse part. Maybe some other time we should be able to take it in detail. And I thank all my panelists for wonderful insight. Each one of you did such a wonderful job and making it so interesting. And uh, all of you have highlighted the multifaceted benefits of sports and the vital roles played by various stakeholders. And the panel reiterated the importance of keeping sports fun and enjoyable for children. The focus should be on participation, skill development, and personal growth rather than just a winning. It means so much to all the new upcoming athletes. Thank you so very much. And over to you, Dr. Bhupendra, for question answer session.
Yes, madam. So in the chat box, I am seeing only one question. I think let's see, Utpal Shah, sir. This is for you.
Yeah.
Child enters ninth standard. So all extracurricular activities be stopped because the popular belief is that only for changing. Parents are very concerned for academics. So what should they do?
See, there are schools in Vadodara who support sports to the extent possible. As I said, there are schools who give relaxation in the school attendance. There are schools who reschedule their examinations also. So you can approach those schools, and I am sure those schools would also be happy to support you out in all ways. And I think collectively school and parents should bring a positive impact on the results of sports. I don't think that should be a problem as of now. There are a good number of schools in Vadodara who support sports now.
Great. There are hand raised. Geeta ma'am wants to tell
I
something.
have seen a player, I think all of you know Dr. Atul Kulkarni. You know him as an infectious disease specialist, but his son, Ashin Kulkarni, I belong to the same native place. I have seen him growing. The parents have sacrificed so much. In fact, one of them parent used to accompany him everywhere. You know about him that his cricket achievement. And Atul was supposed to join. I think if he would have joined, it would have been good. He would have told his own experience. And now also both of them, Dr. Asavri and Dr. Atul, I am seeing them from his childhood onwards, they are always with him. Every aspect they are seeing whatever we are talking. So thank you very much. And Sir Uppal sir, it is really great thing for us to understand what parents are also feeling. Because
Right.
I remember Atul and Asavri, they used to ask me, what should I do? He is a very brilliant in studies, but he wants to go to engineering college. He got admission, that is a different, but can he pursue that career? It is a big question mark. And sports career is very short, but there are different options which Atul Kulkarni told me. They can become a sport coaches, they can start their own society, like we have got a training for the cricket training in Bangalore, no? So those things they can get into that career also. So it doesn't mean that engineering he cannot pursue properly, but as a sportsman, they can have different. Like we have seen Dhoni and these things, they have got their own organizations now to train.
Other businesses, yeah.
Not businesses, in the sports only.
Okay.
Not business. So you don't worry about the child. He should have a basic education, but they can prosper in sports career, not as a sportsman only. Okay.
Can I ask a question, please? I'm sorry, I'm not able to type it in the chat box.
Dr. Sumita Nayak has also raised.
Yes, ma'am.
Yeah,
Am I
yeah.
audible? Am I- Hello?
Yes, please.
Yeah. So thank you so much. It was such a wonderful session. I just had this very basic question.
You are audible, ma'am.
Yeah. Ma'am, just a very basic question since we have the galaxy of panelists here. What is the youngest age at which we can recommend children to begin these professional sports? Because nowadays parents are very keen to push their children at younger and younger ages.
I think already Dr. Sumita, we have discussed. Krishna madam also told, I also told after the 11 years, 11 to 14 years.
Krishna madam.
No. The reason is that they want smaller children, 4 years, 5 years. They say, oh, he's very good. He is very good at skating. He's very good at, playing tennis. They will be playing at home, but they want to put them into professional coaching. So I just wanted an opinion on that, whether it is, it is a good idea to send them out at such young ages and get them trained, or we have to wait till 11 years as mentioned.
We have got a coach with us. Krishna madam will elaborate.
Krishna madam.
Actually, I said that where the technical skill are involved, like athletics, gymnastics, swimming, even for the racket sports also. But the thing is, where the skills or technical drill are matter more over like a combat, not the team sports or the combat sports. There is the starting will be good to start with the 4 to 6 years is very good, but when we are talking about team sports or the combat sports, we should have to go with the 11 years. That's a good one. But like you said that skating nowadays is very popular to start early at the age. So I think my knowledge for the specific games is for the Olympic sports. I think my personal knowledge for the non-Olympic sports or the cricket is not that much. So I could only say that if that is a skill like a gymnastic, swimming, even the racket sports should be start with the early on the stage, early identification. That's a good one.
Thank you so much, ma'am.
But
Thank you.
usually, Dr. Sumita, we tell them to play all the games. We don't tell them to specialize in the early age because it may lead to injury, dropout, and burnout later, and they may not continue that. So, ideal age, as Madam has told, Krishna Madam, for certain games you can tell little early, but professional training, definitely because I am attached to one sport fitness thing, we tell 11 years and above. Not
Yes, definitely, ma'am. The thing is where the I think Utpal sir is also agreed in that because there is not that much session. Of course, you should have to involve with the other sports for the their experience with the skills and the environment, sports environment. But the thing is where the skill is there, that should be like we write a one that again and again and again, so it should be like should be start from the early age, but not the competitive training should be start from the 4 to 6.
Thank you, ma'am. Thank you.
Just one Thanksgiving message to all the doctors that doctors are playing very important role in shaping a career of a sports person. I am a witness of having taken the help and support of so many doctors in Vadodara when Manush was undergoing such issues during his training part or even while he was playing. And Dr. Manoj Bhai and Dr. Sheetal Vaid and Dr. Jayesh Bhai, so many people have helped him out in attaining the stage where he is today. So thanks to all the doctors.
Thank you.
Thank you.
Thank you.
Thank you, sir.
Yeah.
Dr.
Ketan bhai, unmute.
Yeah. Thank you, everybody. And so nice. I have also learned so many things. Very inspirational talk from everybody, and all the panelists were excellent. Thank you so much.
Thank
Utpal
you.
bhai, you are doctor in every aspect because your son is a TT champion and Vikas Thakkar is my colleague. Mano
Oh,
both of you are at the top ranking of
let me share with you a very very good news. आप लोगों ने मुझे लिस्ट तो दे दिया था आज कॉमनवेल्थ मेडल्स का. We have secured one more at least silver medal right now in table tennis team. And the team India would be facing a final team tomorrow. Let's hope for the best and gold.
Yes.
Best of luck.
Wishes.
Thank you.
Best wishes, sir.
Manav is a part of the team along with
Best
Manav.
wishes, sir.
Best wishes.
Best wishes, sir.
Thank you.
Thank you so much, sir.
So,
Okay.
thank you everyone. Thank you, Dr. Geeta Patil, Madam, Dr. Harish Pamde, sir, then Dr. as well as CA, sir. Pandya Madam, Dr. Jaimin Jisalpara sir, for accepting the invitation for today's webinar, and you all have given your wonderful comments and making this webinar wonderful. I here with on this platform, those who are pediatricians, if they are still not the members of our Gujarat Adolescent Health Academy, please be the member of Central AHA as soon as possible. And now we will meet on next last Wednesday of next month for another new interesting topic. So thank you everyone. Thank you so much.
Thank you.
Bye. Good night. Thank you so much, everyone. Thank you.